Starting with the sterile gauze, application with the normal saline only to the wound bed, just a little. No need for soaking of the wound. Applying the old one beside the wound on a draw sheet. This is gently application of the normal saline. That's it. Drying the area by sterile gauze is all what you need. Just drying, application gently of the wound without need of rubbing is all what you need. You can do it twice if there is a lot of maceration in the wound, and if you are not sure that it is not dry enough to start dressing after that. The wound triangle assessment include the wound bed, the edge, and the peri-wound area, which is about 2 to 4 centimeters from the edge. The wound bed here is filled of fatty tissue, which is the subcutaneous tissue, or the hypodermis, which is slightly dark yellow. This means that it is not normal and we call it sloughy. Any infected tissue in the wound bed called sloughy. The edge, if we see it slightly white, this means it is macerated, as we see in the 1 o'clock, 2 o'clock, and 3 o'clock. In the inferior, what we will do here also, after we put a goal for the wound bed and the edge is debrided at the macerated area, we protect the edges by applying the zinc oxide material in the peri-wound area and the edge to prevent maceration later. This is a plan for such wound. Now, what we will do in the wound bed, if we see it sloughy, which means infected, a little bit without too much discharge, we can apply wet to dry dressing or hydrogel for autolytic debridement or enzymatic debridement, not the surgical one, because the surgical will do harm more than do best for the wound in such case. And the tissue, what we will resect is the good tissue and the bad tissue. We will just do a debridement for the edge, which is a little bit macerated, and callus and hyperkeratosis to enhance the epithelialization of the wound.